Hello, beautiful people. It's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehab, here to talk to you again about another topic. Today, I'm going to talk about spasticity. Spasticity is a velocity dependent increase in muscle tone, basically stiffness in the muscles, as a result of some type of neurological condition or deficit that alters the way signals to our muscles and tendons are transmitted. So sometimes you might see somebody who's had a stroke or brain injury or even something like multiple sclerosis or some type of neurological disease have tightness or stiffness in their muscles. Like spastic hemiplegia, as we call it, is when one side of the body is partially paralyzed or weak, or there's a loss of sensation. So for instance, if somebody had a stroke and it affected the right side of their body, you might see them walk with a hemiplegic gait, as we call it. So their right hand might be close to their chest when they walk, or the right foot might drag a little or lag when they're trying to take steps forward. So there are some things that can be done for this, and one of them is stretching. So daily stretching to help stretch out that muscle will help. So for instance, the person who has spastic hemiplegia with their hand towards their chest, their biceps are tight. Sometimes it's the muscles in their forearm, like the supinator is tight and they can't pronate or move their wrist in this direction, so it's stuck like this. So stretching against the tightness is one thing to do daily, very important. The other thing are medications. There are different medications that we use in the rehabilitation world to help combat spasticity. And the third thing are injections like Botox. Now, most of you probably think of Botox as a cosmetic intervention, but actually in the rehab world, we use Botox to help with spasticity. Botox works on this receptor we call SNAP25 to help to relax the muscle so that it will not be as tight. So I will give you a story of one of my patients who I just enjoy working with, and she's so dear to me because her recovery was so miraculously beautiful. But I worked with a young lady who was suffering from a stroke. So she actually had a stroke in pregnancy, or peripartum stroke, where she had a blood clot that went up to her brain and caused her to have a stroke. So she had spastic hemiplegia on her dominant side. So the side of her body, where she would write, she right-handed, that was the side that was affected. So she had this posturing as a result of her stroke, and she was pregnant. So you can imagine how devastating that could be. But thankfully, she worked with me and my team at the time, and she started to relearn the skills that she needed to function, the eating, the walking, the dressing, practicing how she would manage a newborn with this weakness that she sustained from her stroke. And she made it through. She had her baby and continued to work with me. And when she got to a point where it was safe, we decided we were going to use Botox to help release that tension so that she could gain more function in her dominant arm. Now, she was a successful professional woman, now a mother, a wife, and really wanted to get back in the workforce and get back to living life as she knew it. So we did Botox on her arm, and she came back to me a couple months later with a great report that she could now write again using that hand, which she wasn't able to do after the stroke. And on subsequent visits, she just kept telling me about her progress, how she could do her laundry now, and she was starting to become fully independent again. She was getting around to places she had to go without needing someone to bring her, no longer using any devices. And on one of her last visits with me, she shared a video of her in this beautiful dress going out on a date, and she was able to dance. And that was just so heartwarming for me to see how much progress she made. And I believe that can be something you can achieve too. If it's spasticity, something you struggle with after a stroke. A lot of people might not know about the use of Botox in this capacity, so I just wanted to educate you a little bit and share some options that are out there. Now, it's not appropriate for everyone, so of course you would need to be assessed, and your history would have to be reviewed, and if you are taking any medications, to see if there's any potential interactions or reasons why you couldn't use this intervention. But just know that it is something that we do use in the rehab world, and if you are not in the DMV, this is something you can ask a physical medicine and rehab specialist in your area of town or in the world. Now, if you are someone who is severely debilitated from chronic disease, trauma, disability, and would love to partner with a physician who will help you achieve increased mobility, function, independence, and quality of life, I invite you to join me at Freedom Wellness Physiatry, where we believe quality of life is not a daydream, but a reality. And we would love to partner with you in your journey to living better towards a life of wellness and purpose. You can book an appointment at freedomwellnessphysiatry.com. Physiatry is spelled Physiatry. And you can check us out on Facebook on our Freedom Wellness Physiatry page, as well as our YouTube channel for more educational content. Hope this was helpful for someone, and I will see you next time. Take care. Bye-bye.